Hi there, my name is Taylor. This is going to be my intramuscular injection video. So the first thing we're going to be doing is performing hand hygiene, and then I'm going to prepare the medication. So the first thing I'm going to have to do is check the patient's medical history. So I'm looking to see if there's any history of allergies, any history of reactions to different types of medication, anything like that. Next I'm going to check is the name of the patients. So I'm checking the MAR and comparing it to the physician's order. I'm checking the patient's date of birth, the patient's name. I'm checking the patient's medical record number. Then I'm going to check the name of the medication, which is going to be cloxacillin for today. I'm also going to be checking the dosage of the medication, which is 500 mg today, and the route, which is IM, and the time. The time is supposed to be Q 12 hours, so it's every 12 hours, and right now it's 10 a.m., so it's time to administer the medication. So the first thing I'm going to be doing is performing hand hygiene. Next, I'm going to compare the medication that I have on hand. I'm going to compare it to the MARS. So, the name of the medication is cloxacillin. The dosage is going to be 500 mg. It's going to be in an IM route. I'm going to check the expiry date, which is good. And according to the table, I have to reconstitute with 2.7 milliliters of sterile water. I'm going to check the expiration date of the sterile water, which is all good. So according to my table, I need to add 2.7 milliliters of the sterile water. So next I will be hand sanitizing again. And then I'm going to clean off these valves because it's supposed to be an aseptic procedure. Now I'm going to take my 3 ml syringe, which is this one, and my 18 gauge blunt needle, which is that. So I'm going to be using this to draw up my dilute. So first I have to withdraw 2.7 ml of air. And I'm going to expel this into the sterile water. And then I'm going to drop in 2.7 ml of sterile water. And I'm going to get rid of the air bubbles. Okay. So this is the 2.7 milliliters of sterile water. Next, I'm going to expel this into the powder. So this is the medication that I've already done because I've done this video a few times. So now I'm just going to show you how to reconstitute the solution. So I gently roll it to reconstitute it. This is going to get rid of all of the powder, and I'm not going to shake it because this is going to cause air bubbles. So now I'm going to use my 5 ml syringe. And another blunt needle. And this is going to be to draw up the reconstituted medication. So I'm going to drop in, I'm going to draw in 2 ml of air. And expel it into the solution. And then I'm going to take in 2 ml of the reconstituted medication. So that is the 2 ml exactly. Then I'm going to recap it. And then I'm going to change this to a 23 gauge needle, which is this one. Next, I would label this medication with the patient's name, the drug, and the time that I made it. So this is me putting a label on it. Next, I would perform hand hygiene, because this is going to be before I go into the patient's room. Hi, my name is Taylor. I'm going to be your nurse for today. I'm going to be performing your IM injection as prescribed by your doctor. Can I please have your full name and date of birth? Perfect. So now I'm going to compare them more until the patients are done. So I'm checking the date of birth, which matches, the date matches, the name matches, the MRI number matches. So I'm going to compare my medication to the MAR. It's cloxacillin. The dosage is 500 mg, and it's for this patient. So the name of the patient matches. So now I'm going to close the door to provide privacy for the patient. Then I'm going to put the patient in a comfortable position. So next, I would only expose only the area of the patient, only the area that I'm going to need for the patient, and this is going to be administered to the vastus lateralis, which is like on the leg. So I'm going to be doing the muscular area, which is the vastus lateralis, and I would perform hand hygiene again. I would put on gloves. Then I'm going to cleanse the injection site with an alcohol swipe. So I'm cleansing 5 centimeters around the injection site. Then I'm going to uncap my medication. I'm going to pull the skin back with my thumb and my pointer finger, and then I'm going to be injecting the needle at a 90-degree angle. And I'm going to aspirate the needle slowly. And there's no blood, so I'm going to administer the medication over 5 to 7 seconds. Perfect. Now I'm going to press the area with an alcohol swab gently. And then I'm going to assess the area for any bleeding, and there's no bleeding. I'm going to ask the patient to let me know if they feel any pain or numbness in the area. Mr. Wilson, do you feel any pain or numbness in the injection site? Perfect. So there's no pain, no numbness, no swelling. So I'm going to take off my gloves. I'm going to perform hand hygiene. I'm going to ask the patient again, do you feel any pain or numbness in the injection site? No? Perfect. Then I'm going to put the patient into a comfortable position. And then I'm going to document. I'm going to document on the MAR. I'm going to put the name of the medication, the dose, the route, the time that I gave the medication to the patient, and the site of where I put the medication. Then I'm going to sign it with my initials. And that is the end of my IM injection video. Thank you for your time.